Herring Day is observed on March 3rd every year. It is the largest global awareness campaign on air and herring care that calls for action to address herring loss. This year's theme is Air and Herring Care for All. Let's make it a reality. This year's observance aims at 1. Promoting public health actions for air and herring care. 2. Stimulating intersectoral partnership for air and herring care. 3. Heightening awareness on herring loss and care at a national and community level. And 4. Encouraging behavior change towards healthy air and herring care practices. Over 1.5 billion people around the world live with hearing loss, of which nearly 430 million people live with disabling hearing loss. Hearing loss, if not addressed, can lead to increased morbidity and cost $980 billion annually. Hearing loss will rise considerably in the coming decades due to changing population numbers, increasing exposure to risk factors such as recreational noise, as well as persistence of untreated air conditions such as otitis media. In St. Lucia, approximately 1,000 persons are screened annually at the herring clinics at our wellness centers, and a significant number are seen through private means. In 2018, an estimated 700 people were found to have hearing impairment, and in 2021, over 420 people were found to have had hearing impairment. All children up to 5 years of age are screened routinely through the childhood developmental screenings at all wellness centers. Hearing care and hearing loss were highlighted as a public health issue with the adoption of a World Health Assembly resolution on prevention of deafness and hearing loss during the World Health Assembly in 2017. This resolution calls upon member states to undertake advocacy on this observance of World Hearing Day. The Ministry of Health, Wellness and Elderly Affairs wishes to highlight the importance of integrating air and hearing care within primary care as an essential component of universal health coverage. During this year's observance, the Ministry of Health, Wellness and Elderly Affairs will participate in the launching of a new Air and Herring Health Manual. This manual, developed by the World Health Organization, is a practical guide on preventing, identifying, and managing hearing loss and common air diseases that lead to hearing loss. It is intended mainly for healthcare workers at primary care level who provide services to people at health facilities and in communities. Additionally, our ministry will work with the Ministry of Education, ENT surgeons, childhood development and guidance centers, and other partners to raise the awareness of air and hearing care in St. Lucia. Some of the activities include a panel discussion on air and hearing health, broadcasting of messages throughout various media platforms, screening of school-aged children at schools, screening of children with special needs, and screening for hearing loss in the adult population. The Ministry of Health continues to offer 3 air hearing services at the Viewfort and Entrepot Wellness Centers. The Starkey Aftercare Program continues to provide support to hundreds with hearing aid repairs, fittings, and other care support. We will continue to work closely with the private sector and the Childhood Development and Guidance Center in promoting safe listening. Please contact the Viewfort Wellness Center or the Entrepot Wellness Center. Let us all make safe listening and hearing care a priority in our personal activities and in our communities. I thank you.